I think EPHA's membership base is absolutely critical, and that has given it the legitimacy to move forward at a very high, sophisticated level with the EU institutions, that credibility and trust. And I think it's not just a Brussels bubble of organisations that happen to be in this city. EPHA is made up of representative organisations, heavily represented in the Central and Eastern Europe, with very specific, targeted, deliberate projects to bring the views and perspectives of perhaps those who are less heard in the community. And I think that's one really key element.
I think for the Commission, EPHA is an umbrella body, and so one of the things we really appreciate is that EPHA has a huge diversity of topics, so that we can count on EPHA when we have questions on a whole myriad of health issues. For the future, I really hope that we continue our engagement and EPHA continues to be at the vanguard of EU health policy.
I said in my panel that I wasn't optimistic, I was hopeful. And the distinction being that an optimist thinks things are going to get better. Being hopeful means we know things could get better. Now let's work hard to make them better.
I think I was one of the fortunate ones to recognize early that as a healthcare worker, my work cannot exist without understanding and applying public health. And dealing with marginalized groups and knowing how to deal with the obstacles and the challenges that we face due to the circumstances around us and that make health not realized as a fundamental human right.
45,000 lobbyists, and I can tell you that most of them work for this industry. So we need, as EPHA has always been there, it's always been very strong, independent to counter these industries, but we need to really meet them on their ground.
Things might get worse the next few years. We might not see the progress that we want, but I think in the long term there's good reasons to be optimistic.